Good morning, everyone, and welcome to Hot Seat Saturday. I am Earl Stephenson Jr., your Atlanta board certified plastic surgeon, and I welcome you this Saturday morning as I get myself adjusted and ready. I hope you guys had a great week and hope you're anticipating a great weekend. I wanted to jump on today, as I usually do, every Saturday at 11 a.m. Eastern. And I thank you for who've joined me this morning. If you know somebody who wants to join, tell them to pop on over to my social media platforms at Beauty by Design, in my community, the Plastic Surgery Success Network, and on Instagram at ESJ underscore aesthetics underscore beauty by design. So you can get the truth in transformation. So I wanted to do today kind of a hodgepodge. Again, I invite questions. I love questions. I hope that you jump on and ask your burning questions, because this is the hot seat. I want you guys to put me on the spot. I want you guys to make me feel a little uncomfortable, not terribly uncomfortable, a little uncomfortable, so you can get your questions answered, because I'm here for you so that you can make great decisions. I want to work with you if you're interested in getting work in 2024, but you may not be close enough to me. So again, you're getting truth and transformation, and you can take that information wherever you live and make great decisions about your transformation in 2024. So having said that, I wanted to jump on and get, like I said, have a little bit of a potpourri or a hodgepodge, jump around and talk about a different bunch of different topics. The first thing I wanted to talk about, I had a client that is a client that I've known for a long time, almost maybe a decade and a half or so. And she and I were chopping it up, and she mentioned to me, "Hey, I got Botox from you a long time ago. I loved it. Worked great. I, we kind of you kind of moved to a different spot. I couldn't get to you, so on and so forth. I started going elsewhere to get my Botox, and I was told that my Botox doesn't work for me. Botox doesn't work for me." So I said to her, like, "That's possible, but unlikely." So her question really was, can someone develop resistance to Botox? Again, it's possible. Botox is a purified protein, if I can get a little scientific for a minute, a botulism toxin, something that paralyzes you. This purified protein of that toxin is so delicate, and it is less powerful, and it's used in primarily aesthetic surgery to soften activity of the forehead, the crow's feet, and brow. It is used in those FDA approved areas, but it's also used in some non FDA approved areas, such as neck bands, corners of the mouth, to improve the aesthetics of those areas. We're not going to debate that. I did some videos earlier in the week. If you want to jump on my platforms and talk, I talked about that extensively. But in the FDA approved areas, Botox resistance is, again, really, really rare. Can it happen? Yes, your immune system could it could decide one day that "Psst, I don't like this Botox, and we're gonna fight. We're gonna fight the power." And they develop antibodies and they attack the Botox and render it ineffective. That's possible. That's really possible, but it's so exceedingly rare. So as she was telling me this, she's had multiple treatments and it never worked. And they told her that she needed to go to another uh, kindly called neurotoxin or muscle relaxer to help her in her face. And there are other types. There's Dysport. There is also Xeomin, and that definitely can help in those areas. But I like Botox. Botox is a strong brand. It's really consistent in what it produces, and most people are used to having Botox, so it's not an issue. So I said, come over to the office. We'll kind of figure it out. It may be the issue, and she may be right or he may be right, but let me give it a go. So she came over, we gave it a go, and now she not only did was not resistant, she actually loves her results. So the question is, can you develop resistance? Yes, possible, unlikely. This is just my interpretation. Be careful. The reasons that she might have been resistant is that it might not have been prepared appropriately. They might have cut the product, if you know what I mean, water it down, stretch it out so that people make money. Again, I'm not accusing anybody of anything, but that has been known to happen. It could have just been, by mistake, inappropriately prepared. So it was weakened. It could have been that the dosage that was used in my friend, wasn't the appropriate dose. It needed to be stronger. Dosage range can change based on how long you've been using Botox, and it changes. So you have to be flexible and change with it. So you, as the practitioner, or I, as a practitioner, really kind of give you a tailored approach to your Botox. A lot of places will say, if you treat this area as X amount of dollars and this area is X amount of dollars, I treat you. It depends on what you have as far as, you know, your muscle activity, how great it is or how strong it is. If it's really, really strong, then, you may require a higher dose. You may come back 3 or 4 months later, or, we've been having Botox for a year or two and it becomes a little less strong or weakened. And so the dose needs to be adjusted down. So it is not a rubber stamp. So to answer that question, yes, you can have Botox resistance, but buyer beware. If you're told that and you've had especially Botox success in the past, you might want to kind of step back and think about that thing for a second. So that's one question that I wanted to talk about that came up during the course of the week. The next thing I really wanted to get into is that we had a little bit of a discussion in my Beauty by Design group about facial aesthetic surgery. And I'm going to take this Botox down, and then I'm my own director and producer. So I got to do these things. So I'll talk myself through it sometimes. We brought up this picture. So everyone knows, I believe everyone knows, Courtney Cox. And I put this picture up earlier in the week because, again, initially I wanted to be really kind of scheduled with what I talked about, but this popped up on one of my social feeds during the week. And it's no secret that she's had plastic surgery, but she's had really, really bad plastic surgery. Well, let's look at it. And yeah, let's look at it. I had some of my community chime in. And I really appreciate you guys jumping on and kind of giving your thoughts about what she may have had. Everyone agreed that this is bad, and it is bad. So let's break it down. Let's start from the top. Let's work our way down to the neck. So first and foremost, on the left-hand side of the screen, young Courtney Cox looks great. Fantastic. To the right of the screen, old Courtney Cox, not so good. So I don't know what she's had done. I don't know who did this for her, etc., etc. All the disclaimers. At the top, it looks like I'm going to suggest that she's had Botox. That's a minimally invasive treatment. It is the number one non surgical treatment in the world. So we're just going to make an assumption that she's had Botox. Her Botox may have made her a little flat between her eyes. There's a little bit of a shadowing that kind of made her a little flat there. That's the only thing that my eye picks up, but not horrible. Forehead looks smooth, forehead looks clean, all good. Let's get down to her eyes. I do believe she's probably had some upper eyelid lift, a blepharoplasty. Let's look at the eyes. So if you look to our left, nice shaped eyes, nice shaped eyelids. She may have had a little bit of skin removed at the top of her right eyelid on the picture on the right, and you see a little bit of a hollowing there. It's more accentuated than it is in her younger picture. Also, on her left eye, the eye to the left of our screen, you can see a little bit more skin than in her younger picture. Again, it's not terrible, but in an upper blepharoplasty, what you want to avoid is to have this hollowing of the upper eyelid that you look like a skeleton. The upper eyelid is consistent of obviously skin, muscle, and fat, and the tear duct gland that hides underneath the bone out toward the outside of the upper eyelid. When I treat this, I remove the skin, the droopy excess skin to give you a smooth contour. I do not mess with the muscle. I just get beyond the muscle so I can evaluate the fat. And there are two fat pockets. There's one in the middle, there's one toward the nose, and then on the other side of the middle fat pocket lies the uh, tear duct gland or the tear gland. What I do for that middle pocket is I rarely remove it because removing that can really create a deep hollow that is a telltale sign that you've had one, a blepharoplasty or eyelid lift, and a bad blepharoplasty. So you want to make sure that your surgeon does not produce that type of result. That's not a good result, and it is a telltale sign that you've had work done. And in this day and age, still people are a little bit shy about coming all the way out about having plastic surgery. So I think she's had an upper blepharoplasty. I don't think it's a great blepharoplasty, but she's had that. I think the worst or the most telling sign are her cheeks. Her cheeks are just hideous. Again, the picture to our left of young Courtney Cox, great cheeks. As you can see, the cheek is high. It's right where it needs to be. It's not here as it is on the right hand side. The bulk or the fullness of the cheek in her older picture is way too low. It's way too low and it's way overdone. It gives her a low riding cheek, which is really funny looking. It then produces a real kind of hollow area still underneath her eyes. And it gives her, because it's so full, a widened face. You look at her young picture versus her old picture. Her face in her older picture or her current picture shows that her face is wide. It looks odd. It really looks odd. Now, what could have been done for those cheeks? It could have been, and the simplest thing would be cheek filler. And there are basically two cheek fillers. I mean, there are others, but two main ones that people will probably go to. I'll say three. One, you can always go to fat. It's not readily done as a kind of standalone procedure, but can be done. Uh, Typically done sometimes in facelift surgery, depending on what the client needs. So that's one thing that can be done. The second thing can be done are cheek implants, and these are kind of silicone implants, flexible silicone implants that are usually placed inside the mouth, so it's scarless, and it's really hard to, in my opinion, having done quite a few of these in the past. It's really hard to place those too low. One, especially in this day and time, we have CAT scans that can be done and crafted so that we can make custom implants that fit like a glove. And so you want to put that implant up kind of here so that the edge of it, the top edge of it sits there. It gives you volume where you need it. So if these are cheek implants, they were done very poorly because they're placed way too low. And it's really hard to mess that up again, especially these days with all the technology we had. So that's the second thing that could have been done, but it's probably unlikely. The thing that probably was done, she probably had filler, and that's the easier thing to do. It is reversible, where a cheek implant is reversible. You take it out, but you've already stretched out the cheek, so now you've got to deal with the fullness that you once had, and then kind of the deflated cheek. The fat that if you put in fat, yeah, you can't readily take that out. So the easiest thing to do is to use cheek filler because it dissolves over time. Two, if you really hate it, you can dissolve it. Filler can be dissolved with a special medication called hyaluronidase. That's the $1 million word, and it's injected in the office, and it dissolves the filler. So I suppose I'm really thinking that she had filler. What type of filler? So you can have a Juvederm or hyaluronic acid type of filler. The Juvederm has a product. Restylane has a product, but you use that to fill and add volume to the cheek. The second type of filler is called Sculptra, and that really is a filler that stimulates collagen and actually has your body build collagen in those areas. It's really has been used historically in our HIV population because they really have gaunt faces, and that has been used to really rebuild and add volume. She could have had that. But either way, I believe she had a filler of some sort. And it's placed poorly. It's too low. The high point or the full point of her cheek is here when it probably should be here. So again, poor filler. So she's had probably Botox. She's had an upper blepharoplasty, in my opinion. She has had cheek filler. She's also had a rhinoplasty. Pretty sure about that. If you look at the middle part of her nose and young Courtney Cox, you can almost see a little bit of a shadow. And I'm going to take my Santa Claus glasses off. A little bit of a shadow right here that almost looks like an upside down V. And that these lines that we call aesthetic lines come down very smoothly on the right side in Courtney Cox of today. But in younger Courtney Cox, it's a little bit of a broken line. You see a line here, it stops, and then you see the shadow here that starts where that V is and down. In a rhinoplasty, we like to create a really nice line all the way down to the tip on each side so that makes the bridge of our nose look really defined and really symmetric. I will give her rhinoplastic surgeon credit. That person recreated those lines much better than in the younger version of Miss Cox. Where I do have a little bit of a hang up, I believe the tip of her nose is a little full. It looks a little full if I can nitpick. So again, her rhinoplasty it's okay. It's not hideous, it's not terrible, it's okay. I think it's reasonable. So moving down, definitely she's had some filler in her lip. Again, filler in her lip can be a hyaluronic acid product. There's Juvederm is a Restylane product. You can also use fat. It's a more permanent solution, but she definitely has had some type of filler, certainly in her upper lip. She probably has had it in her lower lip. We always usually like to balance the lips. There are certain ratios and certain aesthetic guidelines for creating contours that are natural but fuller. I'm going to say her lips are a C plus. The top lip looks kind of like a single line. In the top lip, we really want to create anatomy that is normal. In the normal lip, despite what you see on all the social media platforms, in the normal lip, you've got a little fullness here, you've got a little fullness there, and you've got a little bit of a dip here. And you want to kind of mirror that for a natural lip. You want volume, but you just don't want volume straight across like a finger or a sausage. You definitely don't want that. So I think she's had lip filler. It's a C plus. She's probably had some type of hyaluronic acid product. Again, C plus. Let's go down to her chin. Now, in young Courtney Cox, she's had a pretty strong chin. It's pretty square, but it fits her face. In the current version, they've kind of recreated that strong chin, but it looks a little weird. So I think she's had something there. It looks still kind of square, which it's okay because that's where she started, but it looks a little wider and a little bulkier and gives her a little bit of a masculine look. It's not really appealing. So, what was done there? What could be done there? It could have been that she had a filler. You can have filler in your lips, excuse me, in your chin. It is temporary. And sometimes maybe that's what you want. If you're unsure as to how this may look, again, like I said earlier, it can be dissolved, it will go away naturally, but you can have filler here in the chin and it can last about a year or so. You can have a chin implant. You can make under anesthesia a little incision underneath the chin, place a, a silicone implant that is kind of crafted for your chin. There are various sizes, and you can place that there. It works really well. It's no problem with that. But you got to make sure that it's aesthetically pleasing. The other thing that can be done, you can have a sliding genioplasty, which uses your own bone by making an incision inside the red part of your lower lip. So this incision is hidden. You kind of disconnect the chin bone. You move it forward or move it to the side or move it back or whatever direction you want to move it because it has great flexibility versus filler, of course, versus a chin implant. You can do all kinds of things with it. And then you secure it with a titanium plate, which is very kind. But I doubt that she had that. That's pretty much overkill for probably what she wanted to do. She's probably had some type of filler. If I had to be pushed that she had a surgical procedure, she probably had a chin implant. But I'm going to say this is filler. But nonetheless, whatever she had, it produced the squareness that she naturally has, but it's too wide. It makes her look too full here and makes her look masculine. So, not great chin surgery or chin aesthetics at all. Not at all. Lastly, I believe she has obviously had some routine skincare, but she's had either some type of laser or chemical peel to her face to create that smoothness. Obviously, she's wearing makeup and that will enhance your appearance. But she does have a smooth texture to her face and almost a pinkish rosy texture, which is kind of a little bit of a telltale sign that she's had some type of laser resurfacing or a deep, medium to deep peel at some point. So her skin, as far as its texture and smoothness, looks great. Looks great. So let's grade this. We're assuming she's had Botox. We'll give that a A minus. She's had an upper lid blepharoplasty. We'll give that a C. She's had cheek volumization, probably by filler. We'll give that an F. She's had a rhinoplasty. We'll give that a B. She's had upper lip filler. We'll give that a C. She's had chin filler or chin implant. We'll give that a D. And she's had laser resurfacing of her face or chemical peel. We'll give that an A. But overall, a really bad aesthetic. I say all this to come to this point. You can have all these procedures. You just got to know what to look for. The laser resurfacing of the skin texture is great. The rhinoplasty is not bad. The telltale sign of her eyes is the hollowing at the very apex or top of the eyelid. The lip is too straight, doesn't have normal anatomy. The chin is too bulky. So choose your surgeon wisely, do research, look at these things. Hopefully, I've given you a few clues to look for when you're thinking about this type of surgery or these type of facial aesthetics. So really give that some consideration. I'm here to toot my own horn just a little bit. I have trained not only in plastic and reconstructive surgery, I trained in oral and maxillofacial surgery. So I have a unique understanding of faces, the bony face, the soft tissue face. I've worked on every aspect of the head and neck, every aspect. I've done reconstruction of scalps, foreheads, eyelids, repaired broken eye sockets, broken foreheads, broken upper jaws, lower jaws. I've done chin implants. I've done genioplasty surgery. I've done cheek implants. I've done volumization of cheeks. I've done reconstruction of cheeks and lips. I've done filler. I've done what I have a wealth of experience. And that's what you want. You want someone with a broad experience because at the end of the day, if things go a little sideways, you want somebody who can take care of it. It's nice to think that you got someone who's a cosmetic surgeon or a facial plastic surgeon or whatever who's great at doing lip fillers and they're awesome. What happens when the lip filler goes wrong? What happens when there's a cutoff of the blood supply and this kind of dies? Are they going to be able to walk you through that and get you to a point where you can get repaired and look natural? And are they going to do that? Can they do that? These are the questions you need to ask yourself. So on that note, I did, as I promised, wanted to go through that. I brought up a question about Botox and Botox resistance. It's possible, but unlikely. Think about why people may be telling you you're resistant. Maybe it's the way they're mixing it, purposely or by mistake. So just think about that as well. Think about maybe they not giving you enough Botox. So again, there's some factors to consider when people tell you you're resistant. So with that being said, I appreciate you guys joining me this Saturday. There's some things I do want to inform you are. We got some things going on. First, I'm going to encourage everyone. If you are not a member of my community, you need to be a member of my community. You need to do it. You definitely need to do it right now. I'm asking you to join my women's private Facebook group. The link is right there. I encourage you to join. I've got all kinds of goodies that are coming down the road. And the first one that I put out yesterday for only people in this community is that we've got a newsletter. We've got a nice newsletter called Elegance. It's a quarterly newsletter that's available to people in my Facebook community. Of course, available to all my clients who are in my practice or in my practice community who I've worked with. And so they will be receiving these quarterly newsletters that is packed with information about what's happening with the office, new technologies and techniques, tips to stay out of trouble, tips for prevention and maintenance, and a little bit of special. There's a little bit of a special in this inaugural edition. So if you got that, you need to search that down toward the end and take advantage of that. So if you want to be part of this and other things that are coming down the line, we've got a couple of really special campaigns coming that I'm excited about, and I'm collaborating with a bunch of people so that we can offer you, so that we can get you on this road for transformation in 2024. Aren't you tired of thinking about doing it? Don't you want to do it? I'm going to help you do it. So we've got some things, but you got to be in the community. You got to be at least in the community. So I encourage you to join. I encourage you to bring a friend with you to join so that I can offer this to you and we can have a dialogue. I want to develop a dialogue with you. And if you trust me, then come on, let's just go and let's get this moving forward. So I encourage you to join the Facebook group. If you're already there, look for your inaugural newsletter, uh, and take advantage of that offer that I have in the newsletter. So I don't want to leave my guys out. I also developed a Facebook group for my guys. So guys get plastic surgery too. And the newsletter is coming really, really soon. So, Modern Gents is my Facebook page for my guys. Guys get Botox, guys get blepharoplasties, guys get liposuction of their flanks and love handles, and guys get liposuction and contouring of their chest for gynecomastia. If this is interesting to you or interests you, I encourage you to at least like my Facebook page, Modern Gents. And then I have a private community just for guys where we can sit and talk about things that we want to talk about to improve our self image so that we feel strong, masculine, and powerful to move forward in life, to take care of the people that we love and the things that we need to handle. So I encourage you to join the Facebook page, and I encourage you to join the Facebook community for men. It's a private community. And on that note, ladies and gentlemen, I have taken up your Saturday, and I hope that you enjoyed that Saturday or this Saturday. I look forward to connecting with you again next Saturday. And if you have any questions, reach out, get to my community, get to my pages, uh, call my office. Office number is 770-466-4700. I'd be happy to sit with you for a personal consultation and discuss your transformation. So, again, at least until next Saturday, I'm out. I'll see you guys in my social media platforms throughout the week. You guys have a safe and wonderful weekend.